Your heart is beating right now, roughly 70 times per minute, over 100,000 times per day, pumping 5 litres of blood through 60,000 miles of blood vessels without you consciously thinking about it. And buried in the pattern of those heartbeats, in the way your body responds to exertion, in symptoms you might be dismissing as normal aging or stress, are warning signs that your cardiovascular system is breaking down. Heart disease doesn't announce itself with a heart attack. The heart attack is the end point of a process that's been developing silently for years, sometimes decades. And there are specific, measurable warning signs that appear long before chest pain or cardiac arrest. Most people ignore them. They rationalize them away as tiredness, as getting older, as being out of shape. But these early warnings are your body telling you that something fundamental has changed in how your heart and blood vessels are functioning. And if you catch them early, if you take them seriously and act on them, you can prevent the heart attack, the stroke, the heart failure that would otherwise be inevitable. Hi, I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly a decade working in AANDE, I've seen what happens when these warning signs are ignored until it's too late. My goal now is to help people recognize them early and take action before irreversible damage occurs. For the next few minutes, we're going to talk about the 5 early warning signs of heart disease that you should never ignore, what they mean mechanically, and most importantly, to what you need to do about them. The first warning sign is shortness of breath that seems out of proportion to the activity you're doing. Not breathlessness after sprinting up 3 flights of stairs. That's normal. I'm talking about getting winded walking from your car to the shop entrance, feeling breathless after climbing a single flight of stairs when you used to manage it easily, needing to pause halfway through making the bed because you can't catch your breath. This is called dyspnea, and it's one of the earliest and most reliable indicators that your heart is struggling to meet your body's oxygen demands. Here's what's happening mechanically. Your heart's job is to pump oxygenated blood to your muscles and organs. When you exert yourself, your muscles need more oxygen, so your heart rate increases and each beat pumps more blood. In a healthy cardiovascular system, this happens smoothly. You breathe harder, your heart beats faster, and the system adjusts to meet demand. But when the heart starts to fail, when the coronary arteries feeding the heart muscle become narrowed by plaque, when the heart muscle itself becomes stiff or weak, the system can't keep up. Your heart can't pump enough oxygenated blood to your muscles, so your body compensates by making you breathe harder and faster to try to extract more oxygen from each breath. That's why you feel breathless. There are 2 main patterns of dyspnea that signal heart disease. The first is exertional dyspnea, which is breathlessness during physical activity that you used to handle without difficulty. This suggests that your heart can manage resting demands, but struggles under load. It's often the first sign of coronary artery disease or early heart failure. The second pattern is orthopnea, which is breathlessness that worsens when you lie flat and improves when you sit up. This happens because when you lie down, fluid that's been pooling in your legs redistributes to your chest and increases the pressure in your lungs. It's a classic sign of heart failure. People with orthopnea often need to prop themselves up with multiple pillows to sleep comfortably, or they wake up in the middle of the night gasping for air. That's called paroxysmal nocturnal dyspnea, and it's a medical emergency that requires immediate evaluation. Now, not all breathlessness is cardiac. Lung disease, anemia, anxiety, deconditioning, obesity, all of these can cause shortness of breath. But here's the key distinction. Cardiac dyspnea typically comes on gradually over weeks or months, worsens with exertion, and is often accompanied by other symptoms like fatigue, leg swelling, or chest discomfort. If you're noticing that activities that used to be easy are now leaving you breathless, that's your heart telling you something has changed, and you need to get it evaluated. The second warning sign is fatigue that's out of proportion to your activity level and doesn't improve with rest, not tiredness after a long day at work or a poor night's sleep. I'm talking about profound, unrelenting exhaustion that makes even simple tasks feel overwhelming. Feeling drained after a shower, needing to rest after walking to the kitchen, falling asleep in the middle of the day despite getting adequate sleep at night. This is different from normal tiredness. Normal tiredness has a clear cause and improves with rest. Cardiac fatigue doesn't. It's present most days, it's worse with exertion, and it doesn't resolve even after a full night's sleep. What's happening is that your heart isn't pumping enough blood to meet your body's baseline metabolic needs. Your muscles, your brain, your organs aren't getting adequate oxygen delivery. So your body compensates by reducing your energy output and making you feel exhausted. It's a protective mechanism to prevent you from overexerting a failing cardiovascular system. Cardiac fatigue is particularly common in women, and it's often the primary symptom of heart disease in women rather than chest pain. Studies have shown that up to 70% of women who have heart attacks report unusual fatigue in the weeks or months leading up to the event. They describe it as feeling like they're walking through mud, like their limbs are heavy, like they can barely get through the day. And they often dismiss it as stress, as hormonal changes, as just being busy. But it's their heart failing to keep up with demand. The mechanism involves reduced cardiac output, which is the amount of blood your heart pumps per minute. When cardiac output drops, oxygen delivery to tissues decreases. Your muscles produce less ATP, which is the energy currency of cells. Your brain gets less glucose and oxygen, which impairs cognitive function and makes you feel mentally foggy. Your body shifts into a low energy state to preserve the limited oxygen available. That's why everything feels harder. If you're experiencing persistent, unexplained fatigue that doesn't improve with rest, especially if it's accompanied by breathlessness, leg swelling, or dizziness, you need to get your heart evaluated. Don't assume it's just stress or aging. Fatigue is your body's way of telling you that something fundamental has changed in your energy balance. And when that change is cardiac, ignoring it can be fatal. The third warning sign is chest discomfort that doesn't fit the Hollywood version of a heart attack. Most people think cardiac chest pain is a crushing vice-like pressure in the center of the chest that drops you to your knees. And that does happen in some heart attacks. But early cardiac ischemia, which is reduced blood flow to the heart muscle, often presents much more subtly. It can be a dull ache, a feeling of tightness or pressure, a sensation of heaviness or fullness in the chest. Some people describe it as feeling like an elephant sitting on their chest. Others say it feels like bad indigestion or a muscle strain. The key characteristics that suggest cardiac origin are these. First, the location. Cardiac chest discomfort is typically central or left-sided, behind the breastbone or slightly to the left. It's not sharp and localized to one spot, it's diffuse and hard to pinpoint with one finger. Second, the quality. It's usually described as pressure, tightness, squeezing, or heaviness rather than sharp stabbing pain. Sharp stabbing pain that changes with breathing or position is more likely musculoskeletal. Third, the triggers. Cardiac chest discomfort is typically brought on by exertion, emotional stress, cold weather, or heavy meals. It improves with rest. If you're getting chest tightness every time you walk uphill or carry shopping bags and it goes away when you stop and rest, that's angina. That's your heart muscle not getting enough oxygen during exertion. Fourth, associated symptoms. Cardiac chest discomfort is often accompanied by breathlessness, sweating, nausea, or pain radiating to the jaw, neck, shoulders, or arms. These associated symptoms are critical because they help distinguish cardiac pain from non-cardiac causes. Now here's what's happening mechanically. Your heart muscle needs a constant supply of oxygenated blood delivered through the coronary arteries. When those arteries become narrowed by atherosclerotic plaque, blood flow to the heart muscle is restricted. At rest, the narrowed arteries might still deliver enough blood to meet demand. But during exertion, when the heart muscle needs more oxygen, the narrowed arteries can't deliver it. The heart muscle becomes ischemic, meaning it's starved of oxygen. That triggers pain signals, which you experience as chest discomfort. This is stable angina, and it's a warning that your coronary arteries are significantly narrowed. If the plaque ruptures and a clot forms, blood flow can be completely blocked, which causes a heart attack. That's unstable angina or acute coronary syndrome, and it's a medical emergency. Women, older adults, and people with diabetes often experience atypical presentations of cardiac chest pain. Instead of classic central chest pressure, they might have upper back pain, jaw pain, arm pain, or just severe indigestion. Some people have no chest pain at all, just breathlessness or nausea. That's why it's critical not to rely only on chest pain as a marker of heart disease. If you're experiencing any chest discomfort that's new, recurrent, brought on by exertion, or associated with breathlessness or sweating, get it evaluated urgently. Don't wait to see if it goes away. Don't convince yourself it's just indigestion. Time is muscle when it comes to heart attacks, and early intervention can save your life. Now, if you're finding this video helpful and you're worried about your own heart health or the health of someone you care about, please consider subscribing to this channel. I promise to keep creating content grounded in the latest medical research to help you prevent the diseases I see in the emergency department every single day. All I ask is that you give this fairly new channel a chance and hit the subscribe button. If you get to the end of this video and you didn't think it was worth your time, feel free to unsubscribe. No hard feelings, but if you give me your time and attention, I'll give you everything I've learned from over a decade in emergency medicine. So please help me reach more people like you by subscribing. And let's continue with the video. The fourth warning sign is swelling in your legs, ankles or feet that doesn't go away overnight. Not the mild puffiness you get after a long flight or a day on your feet. I'm talking about persistent swelling that worsens throughout the day, leaves deep indentations when you press on it, and doesn't fully resolve even after a night's sleep with your legs elevated. This is called peripheral edema, and it's a classic sign of heart failure. Here's the mechanism. Your heart pumps blood forward through the arteries to deliver oxygen and nutrients to your tissues. The blood then returns through the veins back to the heart. When the heart starts to fail, it can't pump blood forward effectively, so blood backs up in the venous system. This increases pressure in the veins, particularly in the legs, which are the furthest point from the heart, and fighting gravity to return blood upward. The increased venous pressure forces fluid out of the blood vessels and into the surrounding tissues. That's what causes the swelling. Cardiac edema has specific characteristics. It's typically bilateral, meaning both legs are affected equally. It's pitting, meaning when you press on the swollen area, it leaves an indentation that slowly fills back in. It's gravity dependent, meaning it's worse in the ankles and feet if you've been standing or sitting, and it shifts to the lower back and buttocks if you've been lying down. And it's progressive, meaning it gets worse over days or weeks if the underlying heart failure isn't treated. The swelling is often accompanied by other signs of fluid overload. You might notice that your shoes or rings feel tighter. Your abdomen might feel bloated or distended. You might gain several kilograms in a short period despite not eating more. You might start urinating more frequently at night, because when you lie down, the fluid that's been pooling in your legs gets reabsorbed and filtered by your kidneys. Peripheral edema can also be caused by kidney disease, liver disease, venous insufficiency, lymphatic obstruction, or certain medications. But when it's cardiac, it's usually accompanied by other symptoms of heart failure like breathlessness, fatigue, and reduced exercise tolerance. If you're noticing persistent leg swelling along with any of these other symptoms, you need to get evaluated for heart failure. Early stage heart failure is treatable with medications, lifestyle changes, and in some cases, procedures that can prevent progression. But advanced heart failure is debilitating and often fatal. The time to act is when you first notice the warning signs, not after the damage is irreversible. The fifth warning sign is an irregular heartbeat or the sensation of your heart racing, fluttering, or skipping beats. This is called palpitations, and while occasional palpitations are common and usually benign, persistent or frequent palpitations can indicate serious underlying heart disease. Let me distinguish between benign and concerning palpitations. Benign palpitations are usually brief, infrequent, triggered by caffeine, stress, or lack of sleep, and not associated with other symptoms. You feel your heart skip a beat or flutter for a few seconds, and then it goes back to normal. These are usually premature atrial contractions or premature ventricular contractions, which are extra heartbeats that interrupt the regular rhythm. They're extremely common and rarely dangerous in people with structurally normal hearts. Concerning palpitations are different. They're sustained, lasting minutes or hours. They're frequent, Happening multiple times per day or week, they're associated with symptoms like dizziness, breathlessness, chest discomfort, or near fainting. And they significantly impact your quality of life or your ability to function. These types of palpitations can indicate arrhythmias like atrial fibrillation, ventricular tachycardia, or supraventricular tachycardia, all of which increase your risk of stroke, heart failure, and sudden cardiac death. Atrial fibrillation, or AFib, is the most common sustained arrhythmia affecting millions of people worldwide. In AFib, the upper chambers of the heart quiver chaotically instead of contracting rhythmically. This creates an irregular, often rapid heartbeat that feels like your heart is racing or fluttering. The danger isn't just the irregular rhythm itself, it's that the chaotic contractions allow blood to pool in the atria, where it can form clots. Those clots can then travel to the brain and cause a stroke. People with untreated AFib have a 5-fold increased risk of stroke compared to people in normal rhythm. Ventricular arrhythmias, where the irregular rhythm originates in the lower chambers of the heart, are even more dangerous. Ventricular tachycardia and ventricular fibrillation can cause sudden cardiac arrest, where the heart stops pumping blood effectively and you lose consciousness within seconds. Without immediate treatment with defibrillation, sudden cardiac arrest is fatal within minutes. The warning signs of dangerous arrhythmias include palpitations that make you feel dizzy or lightheaded, palpitations that cause chest pain or breathlessness, palpitations that make you feel like you're going to faint, or palpitations that are sustained and don't resolve on their own within a few minutes. If you're experiencing any of these, you need urgent medical evaluation. Don't wait. Don't assume it will go away. Arrhythmias can be diagnosed with an ECG and managed with medications, procedures like ablation, or devices like pacemakers and defibrillators. But you have to get evaluated first. So those are the 5 warning signs. Unexplained shortness of breath, persistent fatigue that doesn't improve with rest, chest discomfort that doesn't fit the classic pattern, leg swelling and fluid retention, irregular heartbeat or palpitations. What ties them all together is this: they're all early indicators of cardiovascular dysfunction that appears long before the catastrophic event. Heart disease doesn't develop overnight. It's a progressive process that starts with endothelial dysfunction, advances to atherosclerosis, progresses to flow-limiting stenosis, and eventually results in heart attacks, heart failure, arrhythmias, and sudden death. But at every stage, there are warning signs. Your body is telling you that something has changed. The problem is that most people dismiss these signs. They rationalize them. They convince themselves it's normal aging or stress or deconditioning. And by the time they finally seek help, the disease is often advanced and much harder to treat. In emergency medicine, I see this pattern constantly. A patient comes in with a heart attack. We ask about symptoms in the weeks or months leading up to it. And almost always, they describe progressive breathlessness, worsening fatigue, intermittent chest discomfort, or other warning signs that they ignored or dismissed. They didn't think it was serious. They didn't want to bother the doctor. They convinced themselves it would go away on its own. And then they have a massive heart attack that could have been prevented if they'd acted on the warning signs earlier. That's what frustrates me, because these outcomes are largely preventable. If you recognize the warning signs, get evaluated, and take appropriate action, you can prevent the heart attack, the stroke, the heart failure that would otherwise be inevitable. What to do if you recognize these signs? So what should you do if you recognize any of these warning signs in yourself? First, see your GP or a cardiologist for evaluation. Don't wait for symptoms to worsen. Don't assume they'll go away on their own. Early intervention is critical. Your doctor will take a history, perform a physical exam, and order appropriate tests. These might include an ECG to check your heart's electrical activity, an echocardiogram to assess heart structure and function, blood tests to check for cardiac enzymes and risk factors, a stress test to evaluate how your heart performs under exertion, or coronary imaging to visualize your arteries and detect blockages. Second, address modifiable risk factors immediately. Stop smoking if you smoke. Control your blood pressure and blood sugar if they're elevated. Lose weight if you're overweight, particularly visceral fat. Reduce processed food and sugar intake. Increase physical activity gradually and consistently. Manage stress and prioritize sleep. These aren't optional lifestyle suggestions. They're evidence-based interventions that reduce cardiovascular risk and can reverse early disease. Third, take medications as prescribed. If your doctor prescribes statins, blood pressure medications, antiplatelet agents, or other cardiac drugs, take them. These medications have been proven in large trials to reduce heart attacks, strokes, and death. They're not perfect and they have side effects, but the benefits far outweigh the risks for people with established cardiovascular disease or high risk. Fourth, don't ignore worsening symptoms. If your breathlessness is getting worse, if you're developing new chest pain, if you're feeling faint or having sustained palpitations, seek medical attention immediately. Don't wait, don't convince yourself it's nothing. These could be signs of unstable disease that requires urgent intervention. Final thoughts. Your heart doesn't fail suddenly, it sends warning signals long before catastrophic events occur. Unexplained breathlessness, persistent fatigue, chest discomfort, leg swelling, irregular heartbeat. These aren't just inconveniences to be ignored, they're your body telling you that your cardiovascular system is breaking down. And if you recognize them early and take action, you can prevent the heart attack, the stroke, the heart failure that would otherwise be inevitable. This isn't about fear, it's about empowerment. You have more control over your cardiovascular health than you might think. But you have to pay attention to your body, take warning signs seriously, and act on them promptly. Heart disease is still the #1 killer in the developed world, but it's largely preventable and treatable if caught early. Don't be the person who ignores warning signs for months or years and then ends up in my emergency department with irreversible damage. Be the person who recognizes the signs, gets evaluated, makes the necessary changes, and prevents the disease before it progresses. And finally, if you found this video valuable and you want to keep learning about how to prevent the diseases that I see every day in emergency medicine, please subscribe to this channel. I'll keep creating evidence-based content to help you live longer, healthier lives. Thank you for watching, and I'll see you in the next video.